Patients, advocates, veterans, and friends. We'd like to welcome you to our informational session today. My name is Matthew Bodie. I am the founder of Canon Development and the designer of the International Cannabinoid Institute. If you get time, please take a look at the renderings we have on display here, as well as the informational literature we have back here at the table. We are pleased to announce some exciting things with the International Cannabinoid Institute. It's my pleasure to announce Garrett Greenlee, my friend and the founder of the ICI. He is a graduate of the Ohio State University, the Ohio State University, the founding member and vice president of the U.S. Solar Institute in Fort Lauderdale, Florida. Prior to that, he spent 15 years with York International, where he opened the Columbus office. He currently resides in Columbus, Ohio with his beautiful wife and 4 lovely daughters. It is my pleasure and honor to bring up Garrett Greenlee to speak about his creation.
Thank you all for coming out. I truly appreciate it. My name is Garrett Greenlee. I am the founder of ICI, and truly this is a big event for us because this is essentially our coming out party. We have been working very hard on this facility since about 2013, and when it came to light, the amendment from Responsible Ohio, and we viewed the language, we decided from that point that we were going to figure out a way to work our facility into the confines of the constitutional amendment. And what we figured out is there's not only 10 growing opportunities in the state of Ohio under the constitutional amendment, but there's actually 10 locations. So what we've been doing for the last 6 months now is engaging the individual license owners, the landowners, and what we now can announce is we have secured a contract long-term for 15 acres at one of the sites as designated in the constitutional amendment. And that announcement that we're making today, we're pleased to announce we will be putting ICI in the Licking County facility out in Pataskala. What ICI is, the International Cannabinoid Institute, is an Ohio not-for-profit organization. Something that we wanted to make sure that we were able to do is be able to take care of the patients in Ohio. We saw a need for this because we, like many of you were concerned that with the personal use being legalized at the same time as medical, that the patients would get lost in the shuffle. And that's something that we wanted to make sure did not happen. And what I can tell you now is that we promise to be great stewards of the medical program here in Ohio. And as you see with our facility, we have designed a 40,000 square foot, 2-story facility where we will be designing and engineering strains that are specific to individual ailments for patients. Okay? We invite you, thank you. We invite you to go to our website and join the discussion. At icirf.org, you can go on and take a very quick survey, 12 questions that we are asking, in your opinion, where should we focus our initial research efforts? Do you have, or a family member, are you afflicted with a potential ailment such as epilepsy, cancer, HIV, Alzheimer's? Tell us in your opinion where we should focus our efforts, and we'll take that to heart and we'll publish all the results from across the country and from across Ohio. And we'll let you know what everybody is saying in terms of where you think we should focus our initial research. We put together a very distinguished board of directors, and I can publicly announce 2 of them today. One we have with us here today, Dr. Sue Sisley. The other we have is Dr. Michael Ibba. Dr. Michael Ibba has the distinction of being the chair of the microbiology department here at Ohio State University. And Dr. Ibba, with his influence, we will be instituting a program with PhD students to do some cross cross-research with Ohio State and be able to set up a program for a doctorate program. We have a couple other announcements in terms of initiatives for the International Cannabinoid Institute today. The first one is our Ombudsman program. This is something we feel is unique and something that we have made the commitment to the patient advocates that we have office space for the Office of the Ombudsman at ICI. The person that we're going to bring up today to talk about that is Janet Brenneman. Okay? Janet is a professional nurse for over 14 years. She's been in the healthcare field for her entire career and is a member of the American Cannabis Nurses Association. She's a founding member of the Ohio Cannabis Nurses Association, and in 2010, her husband was diagnosed with rare stage 4 cancer. She discovered that the patients who use cannabis in addition to chemotherapy and radiation had much better outcomes. After she lost her husband's battle to cancer in 2011, she made the decision to focus her career on medical cannabis and has spent the last 4 years educating herself about medical cannabis. So with that, I'd like to bring up Janet to discuss our Patient Ombudsman program.
Good afternoon. First of all, I'm honored to be chosen to speak for the Ombudsman Advisory Committee and to be part of ICI and their mission. Comprised of patients, patient advocates, healthcare professionals, the Ombudsman Advisory Committee will have the direct contact with the patients of Ohio, acting as a sounding board and collecting information to ensure the needs of Ohio patients are being met. The committee is tasked with assisting the Ombudsman in developing recommendations and then requesting the ICI board to consider their decisions. As a patient advocacy watchdog group, we will engage the Ohio Marijuana Commission and demand that patient prioritize regulations. There have been 5 members that have been appointed, and we are looking for an additional 3 to 6 members. If you're interested in being a member of this advisory committee, please contact ICI for more information. I would like to first start to introduce the committee, and we're first going to introduce Dana Kovac. Dana is a veteran of the United States Navy. She is active in her church and her community. She is currently a full-time caretaker to her oldest son, JC. JC's in the house. JC was diagnosed with stage 4 rhabdomyosarcoma at age 3. Dana describes herself as a mother and a veteran on a mission to advocate for all who would benefit from the legalization of medical cannabis. Thank you, Dana. Next, I would like to introduce Robert Kolkowski. Robert is a native Ohio, and he is a veteran from the U.S. Air Force. Robert served 2 deployments in Iraq and now suffers from PTSD or post-traumatic stress disorder. The traditional treatments did not give him any relief of his symptoms, so he moved to Arizona to become a medical marijuana patient. Robert had great success using cannabis, and he has now returned to Ohio to fight for cannabis as an alternative medication for PTSD, and he is currently active with the Green Fight Vets organization. Robert Ryan. Robert Ryan is currently a delivery systems specialist overseeing research and development for the emulsified flavors at Flavors Producers Incorporated. Robert has over 5 years of experience in product formulation and method development. He's a passionate advocate. Robert wants to participate in the industry driven by medical research and standardized testing for the marijuana cannabis. Thank you. Amy Wolfenbarger. Amy is one of the most active, respected, recognized patient advocate in the state. Amy has 22 years experience working in long-term care, and first as an LPN for the past 10 years, she has owned and operated her own home care agency. She has worked with the Ohio Rights Group and most recently Ohioans to End Prohibition. Thank you. Nicole Schulten, she could not be with us here today as she is enjoying the redwoods with her husband and her daughter, Lucy. Nicole is a former public health school educator and turned patient advocate and has worked as a director for the Ohio Families Can, a parent advocacy group to link and educate our state officials and medical professionals about the reality that cannabis is medicine. She's learning about the promising treatment opportunities from medical cannabis, and Nicole has developed relationships and has learned from the parents and the industry experts around the nation, with the ultimate goal of playing in a supporting role for pediatric and adult patients in the state of Ohio. We look forward to working with the patients of Ohio and being a strong voice for them at the State House. At this time,